Thank you, Emma. And we have two guests with us today. We have Cerith Flinn and Dr. Stephen Thomas. Would you like to both introduce yourselves?
Hey, I'm Cerith Flinn. I'm not Kirsty Ratcliffe, as my name says on the screen. That's my girlfriend's profile. I don't know why that's come up. But yeah, I'm Cerith Flinn. I'm an actor. I'm a writer. I'm based here in London. I'm a type 1 diabetic.
Thank you so much. And Stephen, are you with us?
Yes. Am I unmuted now?
Yes, you are.
I'm Stephen Thomas. I'm a diabetes doctor at Guy's and St Thomas's. I have a role advising on diabetes across London and within King's Healthcare Partners like Khalida.
Thank you both so much. We look forward to chatting with you some more. So today I'm going to pass you over to Emma first, and we have a little bit of a different activity for you all.
Hello, yes, so today we'll be able to see on your screen first. Please feel free to answer, and then we will discuss the results after the interview with Cerith has finished. So first of all, is your experience with diabetes represented realistically in movies and series? Yes or no? The way diabetes has been reported in the media in the last few weeks has made you feel how? Hopeful, frightened, calm, stressed, neutral, angry? Have you seen any media, TV, movies, documentaries, news articles that represent diabetes well and accurately? If so, please share this in the chat function, the title, and be able to discuss and make a little list at the end of the webinar to share with everyone. Thank you.
Thank you, Emma. And I think whilst you're answering those questions, we'll pass over to Khalida. Thank you, Khalida.
Great. Thank you, Rebecca and Emma, and welcome again to Cerith and Stephen. Actually, I think you're also both Welsh as well. So thank you, Cerith. And yeah, I can see that people are responding to the polls. Starting webinars. They are online, interactive webinars, sessions for people with diabetes, an opportunity for you to talk about the psychological aspects of diabetes, especially pandemic. They're not here to provide a specific clinical service, but if you do have any urgent diabetes or mental health issues, you must contact your GP or your diabetes team. The format of the webinars is that first interview Cerith, and then move on to interviewing Stephen, asking them various questions around their mental health. But there's an opportunity for you to be commenting on the chat function, but also asking questions. And once we've completed the and other members of this panel, their feedback on these questions. So I'd like to start off then with you, Cerith. Thank you again for joining, and just tell us a little bit about yourself. You've already given some indication that you're not Kirsty, and you know that you're an actor and a writer, and that you've had type 1 diabetes. But tell us a little bit more, like how old you are, where do you live, and when were you diagnosed with diabetes?
Thank you, Khalida. Yeah, so my name's Cerith Flinn. I'm originally from South Wales in a town called Llanelli, which is it's quite hard to pronounce, so I won't get you all to do it. But it's basically next door to Swansea. Maybe just over 18 years ago. So I've lived here. I'm 33, so I came here for drama school, and I was diabetes when I was around 10. So I was 10 years old when I got diagnosed with type 1 diabetes. And yeah, that's the journey that I've been on since.
Tell us a little bit about that. What's your memory of it? What was your memory of being diagnosed?
It's, you know, it was very, very early on, wasn't it? So I was 10 years old, but I can remember the day that it happened. I can remember the doctor saying to my mum, so we went down to the GP service, and you know, they tested my blood, and it was around 29, I think, at the time, which is extremely high, as we know. And I can remember him saying to us that, your son's, he's diabetic, he's type 1 diabetic, you need to get him straight to hospital to administer the insulin and to get him started and all that. And it was incredibly surreal, if I'm being honest. It was all those questions go through your head when something traumatic happens. Why me? Is it really happening? Is my life over? I can remember getting home, my mum packing an overnight bag, sitting there on the sofa with my sister in silence, just thinking, what is happening? What is happening? Just been playing football with my mates, and suddenly I'm now in this. We go to the hospital, there's nurses all around me. My dad joins us later from work. Everyone's worried. Luckily, my dad he worked for a pharmaceutical company, so he was sort of clued up on all of it and sort of put my mum at ease and my sister at ease and me as well. But it was hard. It was a weird time, and I think the penny drop moment happened probably in the weeks leading up to my diagnosis, when we realized something wasn't quite right. I was just really just wanting to get down on my hands and knees and drink puddles of water. I was getting up in the middle of the night, peeing about 5 times a night, every night. I'd lost a lot of weight, for a kid of my age, and which we thought was just down to me being lean, because I was a really fit kid. I had this really intense football schedule. I was playing for the pro academies, Swansea and then Cardiff, and so we just thought it was down to that. And then I was also just really lethargic, really tired, and had no energy. So yeah, that was tough. I mean, and then that kind of links into what I'm doing now, I suppose. It's the 40s, it's not to jump the gun, but that's where I'm at in my life now, where, through Diabetes UK and Diabetes Cymru, I'm trying to raise awareness for, the 4 most common symptoms of type 1 diabetes. And and that's what I went through. And it was all evident.
And the way you describe it, it's really vivid, isn't it? You still remember it in quite a lot of detail, especially wanting to be on all fours, drinking water from a puddle. That's pretty of imagery, isn't it?
Yeah.
But what about the sort of the psychological aspects? I mean, you've described the period of being quite surreal, which is, I suppose, a period of being a little bit numb, isn't it? After a big trauma, there's an element in which one's a little bit in shock and a little bit dazed. And you said the penny was dropping earlier, but when did the penny drop that you've got diabetes for life? And
yeah, good question. I think it was. Do you know what? It's always something. As a kid, you just throw into it, and you've got to tread water, and you're treading water, and you're just told what to do as a kid. You're being fed this information, and your parents are trying to help you as best they can. Make your way to each lifeboat. So the sort of process for the rest of my life never really entered my mind but it's just something that I just accepted. I've always been a very positive person. I've always just had that mindset of, look, these are the cards I've been dealt. Let's just get on with it. And I think that's the way I adopted it. I'm not saying it wasn't tough, because it was. As a kid, you deal with the hypos, the low blood sugars, feeling like the life out of you, a la Harry Potter, and you get sweaty, you get faint, you become lightheaded, your speech becomes incoherent, and then you've got the highs where you just become irritable. And so all those kids, it was hard to understand, for sure. But like I said before, you just sort of get on with it. You just, now as a 33-year-old man, is so much further down the line. works. I know when my blood sugar is, what time of day it's going to dip, and when I need to have that apple to just at a good level. But yeah, as a kid, it's figuring all that out, and so it's a roller coaster ride for sure.
But what you also said, which I thought was very touching, is and very powerful and probably very important, that's helped you to get to where you are now, is not just your sort of personality. You're saying that your personality has always been quite a positive, upbeat one, but the way you described the life buoys that your parents were throwing at you, and it sounded very much like your parents were on that journey with you and your sister, that you're all in this sort of swimming pool, as it were, and they're with you and taking you one step further. And so that really sounds like that support from your family was probably quite crucial.
Massively crucial. I can remember the first time I injected myself in front of them. You know, I had this wonderful diabetic nurse called Nancy, and she's no longer with us now. But I can remember we were sat in the telly room, and I was on one sofa, and Nancy was on my right, and then my mum, dad, and sister were opposite me, and it'd always been my mum injecting myself, and or my dad, and it was, you know, Nancy was like, right, come on, you're gonna do, and she was one of those sort of old school, come on, you're gonna do this, come on, you're a big boy now, you can do this, you know, that push that you need, and I can remember, you know, I was fighting the tears and sort of seeing my mum, dad, and my little sister was just looking up at me, you know, just seeing her big brother who she, you know, really looks up to, and, you know, he's there with this sharp object, and he's having to pierce his skin with her, and I can remember her eyes and her face now, you know, it was almost brings me to tears now. But so yeah, that journey as a family, we definitely went, and we're still going on it. Yeah, I think, you know, any diabetic, you know, any diabetic, and I think that's what I've learned as I've gotten older. You're not alone. You know, we're all in this together, and it's very normalizing and reassuring and comforting to know that the struggles that I'm going through are exactly the same struggles that you're going through, and that's a very comforting thing. And yeah, the support of my family is pivotal in not only my, you know, my diabetes development, but my development as a human being. So
a few people have said that they have found diabetes has helped them develop their personalities and to be stronger. Of course, as a psychiatrist, I sometimes have to see people where that hasn't happened, where their diabetes and their relationship with their family members has not been so good, and so their experience of diabetes has been less supportive. So it's great to hear from you that it is possible, you know, and I was also nearly moved to tears when you described your little sister looking up at you, and what sense of responsibility you must have, that I must do this, not just for myself, but for my family, for the people that I love. I must look after my health in order for me to have these relationships with my family.
Absolutely. I think I think that's the key word, is responsibility. I think it's taught me responsibility. It's given me that responsibility in life. You know, I had to grow up very quickly. As a 10-year-old, 11-year-old, 12-year-old, as you're growing up and you're wanting to experience all those things as a teenager, the hormones, the fancying, you having your first crush, and getting in with the group of friends, and trying to get on the sports team, and the tests and the exams, and all those emotions that you get as a kid. But then on top of that, you've just got to make sure that your blood glucose levels are still between 4 and 8, and, you know, that roller coaster of a ride. And I think, yeah, responsibility is a very good word to attach to early growth of diabetes.
Yeah, and it's responsibility to yourself, isn't it? And I think that's the important bit as well, isn't it? That it's to yourself, to your body, to your health. If you want to get on with the things that you want to do,
absolutely,
you have to there's a part of you that has to look after yourself and attend to yourself. So you've said some really positive things, and that's really lovely. I mean, what about some negative experiences at a personal level of living with diabetes?
I think, like I said, it's the roller coaster ride of controlling your blood sugar levels. I think that is first and foremost the the challenge that every diabetic faces. And as you learn, it's just relentless management. You never get a rest from it. You never.
How do you manage that then psychologically? You know, people talk about the 24/7, the constant burden. It's always there in the background. You know, whatever you're doing, it's always there in the background. How do you not let that get you down?
It's hard not to let it get you down. I think, you know, we all have this challenge. You know, whatever challenge it may be type 1 diabetes, it may be whatever, but it's not allowing it. I think I very quickly, I mean, it's only in the last 7 years that I've actually started to fully celebrate that I'm a diabetic, is the best way of putting it. And I didn't like that word of associating my diabetes as a challenge, you know, the downbeat, the mental struggle. So it's, you know, this challenge of my autoimmune, because it's so much more than that. I had to stop viewing it as a challenge in order for me to progress. And I think I'd gone for so long kind of being embarrassed by it. I think as a child, whether I knew it or not, I was essentially embarrassed by it. I was, you know, only mentioning it to people that I trusted, you know, and I didn't want to kind of stand out from the crowd in school. And, you know, people wouldn't really understand that, I suppose. And, you know, understandably, they'd be quite ignorant of that. They'd say the classic things like, you know, you're not fat, and how are you diabetic? You know, did you eat too much as a kid, and all that type of stuff. But so handling it has been difficult, but it's linking it back to the word challenge. I see it now as which you cottoned onto. I see it more as a superpower now. You know, it's not a challenge. It hasn't got those negative connotations. I wouldn't be the person that I am today without my type 1 diabetes. That's the easiest way of saying it, you know. Whether I knew it or not, it's always been my superpower. It's been my source of resilience. It fuels me every day. It helps me achieve every goal and ambition that I've ever set out on, you know. So that is the way I see it. So I know it's easier said than done. I know it is. But whenever I've had those negative thoughts come into my head, I've just sort of said, no, come on. You're a type 1 diabetic. You are Cerith Flinn. Use it. Let it fuel you. And that's how I've got through a lot of the struggles in my life, a lot of obstacles that I've met in everyday life, in work life and personal life. I'll always come back to, do you know what? They're not as hard as being a type 1 diabetic. So, and that's always got me through them.
What you're saying is, for about 15, 16 years, you had that sort of background feeling of a little bit awkward about having diabetes, shy, embarrassed. And then there was a turning point. It sounds like there was a turning point when you were about 27, 26, yeah. 27. I'm quite curious about what was happening then in your life. Was it, you said that I got fed up of always thinking of the diabetes as a poison chalice, a challenge, you know, a burden. And did it literally happen overnight, or was there something else going on in your life, or was it a period through which you did some thinking?
I think, you know, it kind of was an overnight thing. It literally was, as weird as it sounds. I'd never been negative about it growing up, but I'd always just, like going back to earlier, as a kid, you're thrown into the deep end. You've got to just live with it. But then I just had a moment where I was just like, do you know what? You need to fully understand this. You need to, you know, I'd coped with it. I'd lived with it. I'd had good control. My HbA1cs were good, but I wasn't really putting any conscious effort or know-how into it. I was just plodding along. I was just getting on with the life, you know. And I thought, no, you know, and I didn't have any role models. I suppose that's what it boils down to. I didn't have any role models growing up that I knew as diabetics. I think the only one was Gary Mabbott, who was a Tottenham footballer, Tottenham legend. I'm not a Tottenham, my best mate's a Tottenham fan, but so that was the only one I knew of. And I think I'd done a couple of jobs. and I'd been introduced to this a wider audience demographic, and I was getting exposure through that, and I was meeting people that I would have never met.
You will come back. We lost you for a bit, Cerith, on the internet.
No.
It's not your fault. It's just the internet.
Where did I last get to?
To Tottenham, the
Gary Mabbutt. Yes.
Yeah.
So I'd done a couple of jobs, and I've lost my train of thought. I'd done a couple of jobs, and I was being introduced to a wider audience demographic, and I had this nice exposure to the jobs that I'd done, meeting people that I wouldn't usually meet, and I just thought, you know what, we're in such a pivotal time of social media and platforms that we can be heard on and listen to, and I just thought, you know what, we're in a time where we shouldn't be filtering or hiding our feelings, and in particular me. I'm talking about me there, you know. I was so I just made it. I've made a conscious decision to celebrate it, you know, and to talk to people, to raise awareness, to be that role model, sharing it with other type 1 diabetics, you know, children, teenagers, mums, dads, newly diagnosed, people that have lived with it for God knows how many years, you know. And
so are you saying that it sounds like what you're saying is that there was a turning point in your career, in a way, that
yeah.
And
yeah, it was, yeah.
the point in which you could say, do I go ahead with my career? And but in order for me to do that, I have to be more of myself. I have to be honest with myself. And in order for me to progress with my career or the way I want to live my life, isn't it?
Good. Yeah, it's a very good way of putting it. It definitely is. My career was definitely progressing and climbing, and I was getting more exposure. And I suppose, I had to, more things were being spoken out about me, and I wanted people to know that. I always put it like I'd done lots of fantastic, great acting roles to get me to this position, but the biggest, the best, the hardest, the most demanding, the one that I get critiqued the most on by myself, the harshest critic, is my role as a type 1 diabetic. And that was my sort of penny drop awakening moment. I was like, this is the best role I've had. This is what I should be shouting across the rooftops as, you know. My Instagram posts on, I'm on tonight at 7:00, I'm on tomorrow at 6:00. Yeah, it's great, but I'm so proud of being a type 1 diabetic. I know that's a weird way of putting it, but I am. And there's no getting away with it. There's no reversing it. I have got it, as you put, for the rest of my life. And that's why I decided to celebrate it. Yeah. And to make people realize that they're not alone. You know, it's, you know, growing up, navigating it, I wasn't perfect, and I'm still not perfect. And I wanted people to know that you don't have to be this perfectly controlled diabetic to progress. Yes, you need to be within the certain parameters and boundaries and look after yourself. But, you know, I still get my moments where I will have a random low that I can't explain. And I used to really beat myself up about it. But it's adapting to that. It's adapting to that and learning from that. And that's what I wanted to do. I just wanted to get my message out there, talk to people, raise awareness. You know, I've been very lucky to be introduced to Diabetes UK, you know, and the work I'm doing with them.
And Cerith, how did you decide to do acting then?
Good question. Yeah.
You're a football star, weren't you? And
yeah. So I started off. I wanted to be a footballer. That's, you know, I was playing in the pro youth academies for Swansea City, really intense level from the ages of 12 to 15, which was hard. It was because you're navigating diabetes as well, you know. So that's
and growing up.
So you've got all that mixed in. I then jumped ship and went to Cardiff City, which any football fans, the rivalry between those two clubs is massive and intense. But that's a whole different story. So, and I played for them. And yeah, I got released by them. That was heartbreaking at the age of 16, 17. But I think it was a blessing in disguise, because it allowed me to put all my eggs into the other basket, which was acting. And that was kind of running parallel at the same time. I was doing my shows at school, I was doing my National Youth Theatre, you know, and when I got released by football, I was like, no, actually, my passion is acting. And so I went to drama school, came to London, hence why I'm still here now, and got my agent, one of my agents, and I didn't look back. And
so tell us a little bit about your acting. What you said, you know, when you said my most hardest challenge as an acting career is, you know, and I was expecting you to tell me about a show, and actually you talked about your diabetes, so as the biggest role that you've had. But what about in terms of your work? What has been the work that you're most proud of in acting?
Every job that I've done as an actor, I've been very, very proud of. I think it's such a crazy, demanding, soul-destroying, great industry. You know, the highs are high, the lows are low, and I definitely experienced that as a young 20-year-old Welsh boy living in London. I'd be working for, you know, 2 to 3 months, and then I'd have a gap of like 6 to 7 months, and then I'd be working for 2 weeks, and then, you know, it's always on and off, and sharing that with the diabetes control, you know, beating yourself up about, you know, a high or a low. And but yeah, I got to the stage, I got to about 27, where I got my sort of a break, and I did some good TV shows, and the work luckily since then has kept on coming in. But every job is demanding in a different sense, whether it's TV or theatre, or, you know, the odd commercial here or there. I think in relation to diabetes and how I cope with it on set or on stage, and I only learned this very recently. I did a very demanding theatre job about 2 years ago, where I was in rep, which repertory theatre, which means you're doing 4 different plays at the same time.
Right.
And that was for 6 months. So you're doing one show in the afternoon, you're doing another show at night, and that goes on pretty much every day. So you've got all the sort of madness and strain of learning these lines, multiple scripts, but you're also, I would find my adrenaline would just rocket my sugars up. Adrenaline that I'd never experienced before. I think TV and theatre are 2 very different mediums of work, and TV I really enjoy, but you can have your moments of, right, I can get my meter out and test my blood glucose sensor on my arm in between each take and make sure I'm okay. But with theatre, you've got to make sure your sugars are bang on the money before, you know, the curtain goes up 7:30, because I was often on stage for, you know, over an hour non-stop, you know, before I could come off and have a quick check. So the control and management of my diabetes in my work has been a work in progress for sure.
Yeah. And when you talked about superhero, you know, and I was thinking, is your diabetes superhero an act? Or is it, you know, could you tell us a little bit more about how you've come to define your diabetes as a superhero and how it helps you?
It's definitely not an act. I really view it as that. I feel as if it's as I mentioned, it's my source of it's my source of energy, my source of resilience. It fuels me all the time, and I relate that to a superpower. You know, that's the best way I can describe it. You know, these you know, encouraging, motivational feelings that I get from having it are superhero-esque. I'm not saying I dress up as a superhero every Friday night and don a cape and a mask or anything like that, but it's how I feel.
If you did, what would the letter be? Would it be a D?
It would be a D. Yeah, big capital D.
Yeah.
I think. But you know, that's how I feel. That's how I feel.
I mean, I think perhaps what you're saying is that I have had to look after something so difficult, really, you know, the burdens, the highs, the lows, it's from the age of 10. And I think what you're saying is that if I can do this as a little boy,
yeah,
right to a young man, you know, give up football, start a career in acting, if I can do all of this with my diabetes, I really can do anything. I think that's the point you're making, isn't it?
You really can. You really can, and and that's the message that I give to people out there. You know, to have that belief, to have that courage, you know, that confidence to get out there, to overcome your challenge, you know, and turn it into your own superpower. You know, my injecting myself is my superpower. You know, in the school canteen, on a busy tube, on a bus, at a workplace, you know, with glaring eyes, you know, overcoming that made me stronger. That's my superpower.
Yeah, that is incredible.
Balancing my carbs, you know, and all that.
Really precious stuff that you're saying. I'm aware that time is moving on, that Stephen is here with us as well. So, Stephen Thomas, thank you so much for joining us.
Well, don't worry about my time. I mean, that was incredible, I think.
Yeah.
And
you're not just saying that because he's Welsh.
No. I'm not even from. I'm from Caerphilly. We don't even know where Llanelli is from Caerphilly, to be honest. No. I thought that was superb. I thought that was really, really inspirational.
Yeah.
I mean, I just say something in response to that. So my first experience with diabetes was a friend who developed it. As Khalida knows, I still play some tennis, but in those days I used to play hours of tennis. And in truth, I was better than my friend at tennis, but his work rate and his energy was colossal. And then he developed type 1 diabetes. And I could just, as a child even, I could just see the effect it had on his energy levels and his physicality. And I'm old, so it was before the internet, it was certainly before social media. And Stuart had nowhere to go. We're in a relatively, Caerphilly's a small place. He didn't know anybody with diabetes. He had no role models. For people like Stuart nowadays, listening to you, would be just amazing, I think. The fact that you went on in your sport and got a trial with Cardiff, and let's be clear, that's you know, that's pretty high level sports. I mean, to get a trial as a professional, even that is a very high level. So the fact that he went on to do that and then build a second career, Stuart was diagnosed now, what you just said would be absolutely inspirational, because the poor guy was destitute because his whole life was sport. So what you said is just amazing. So I could listen to that all day, to be honest, so don't worry about me.
Definitely, and I hope Kerith will get a chance to continue to talk to you in the future, because you are inspiring. Stephen, tell us a little bit about yourself, like, you know, like where did you study and how long have you been a doctor for, and how did you end up in diabetes? We can't quite see your face if you're able to just move the camera down.
Okay, so my camera skills are zero. You're lucky you're not seeing the sky as they usually are when where am I now?
Halo.
Am I on? So as the joke goes, I've got a face for radio anyway. So, but the so yeah, I as like my colleague here, I've born in South Wales in a place called Caerphilly. It's very near Cardiff. And I trained in medicine in Southampton. I was initially training in kidney medicine, in fact, in a later stage of my career. And then I moved to diabetes because it was obvious lots of people with diabetes were developing kidney disease. And I moved to study kidney disease in diabetes. And then I had a choice whether I went into diabetes or stayed in kidney disease. And actually, I thought it would be better to, and I think, you know, my memory of Stuart developing it as a teenager was part of this. I thought it would be more useful to stay in diabetes and try and prevent some of these complications than going to kidney medicine and just treat the advanced stage of the complication, if that makes sense. So I guess my interest in diabetes has always been in the prevention of any complications and the maintenance of health in diabetes, which I've been doing, as you know, Khalida, now for many years because I'm old. And that's how I got into it, really.
And you've heard Cerith talk about his approach, which has been of positivity and trying to look at aspects of diabetes as building his strength, his superhero, and looking at it as, I can control this, therefore I can control anything. I think that's about right, isn't it, Cerith? And what's been your own observations as a clinician diabetes for the past, shall we say, nearly 30 years, of the different psychological aspects of people with diabetes? What have you noticed?
So it's hard to add to a very erudite description just given. So I think there's definitely, people are very traumatized when they develop it. There's definitely a big reevaluation of life, and then I think people do go in different directions, and you've got a very inspiring example there. I am a Tottenham Hotspur fan, and there was a time in my career when the only body that anybody knew that had diabetes was there were two people, Harry Seacombe, a famous actor, and Gary Mabbott. Those are about the only two people that ever heard of. Gary Mabbott gives a very similar description if you talk to him as to what you just heard, just about he was already playing for Tottenham when he developed it, and he had to decide whether he's going to carry on with that career and put what is required in to do that, or whether the diabetes wins, as it were. So that's his words. Other people, yeah, are very there's always a trauma at the beginning, and then I think people react to it in very different ways after that. I think the majority get on with it, and they make the diabetes a part of their life, but they try not to make the diabetes define them in any other way, really. They try and be defined by other things other than their diabetes. There's no question, though, for some people, the anxiety of the day-to-day sugars is hard to get over. And for some other people, the anxiety of developing complications is hard to get over. And that does become too big a part, maybe, of their day-to-day life. But the majority, I think, are amazing with the way that they incorporate it, and they carry on, and they just do all the stuff they want to do, and find a way of managing the diabetes while doing that. I have to say, I've looked after many actors and actresses in my life, and I think that's a particularly demanding job. I mean, we always know the famous actors and actresses, but the majority I've looked after have always, for 20 years had part-time jobs, and often two jobs at once, one acting, one non-acting. So, and it's an incredibly demanding job to do it in. But all the different jobs I've looked after doctors who have diabetes, who specialize in diabetes like I do. And they would say something very similar. So they know
So what did you think?
Much about diabetes than anybody on the planet.
Thank you. What did you think about Cerith's comment about Nancy, the nurse, who was helping him become independent in injecting insulin? I thought that was a very powerful story, and the point you were making is that having a really good relationship with your diabetes health professional is very important if you're looking at if you've got diabetes. Do you have any thoughts about that, Stephen?
Well, so clearly the role of everybody looking after anybody with diabetes has to be to make that individual as supported, confident, and independent as possible. That is the definition of what we are supposed to be doing. So there will be times people need our advice and help, but really 90% of the job is trying to enable that person to be as independent and as confident in what they're doing as they can possibly be. And clearly that's what the nurse did at that point. And of course, as a teenager, you want to be independent with your diabetes. And as you grow up, you also want to be independent a little bit of your parents. So it's particularly vital then, I think, to have control in those areas. Otherwise, you can't have one without the other. And every teenager, sooner or later, wants to become a bit more independent of their parents. That's a normal, healthy reaction. So clearly that nurse got it, and she did it well, and Nancy was on the right track. I think over the years we've got better at recognizing our role to supporting people to look after themselves in that way, rather than trying to do things for everybody, which is just not possible and doesn't really empower people.
Yeah, thank you. And I mean, you made me think about things that I've talked about with some patients who don't have happy families, unlike Cerith, you know, where actually the diabetes clinic is as if it's a professional family. You know, it's a place of safety for a lot of people with diabetes, isn't it?
So I think, yeah, and I don't see any. I want people to feel confident, safe, and I want them to feel. I want them to have those kind of relationships, really, because again, it's a team game, really. Some aspects of medicine, you are looking after somebody's health. If somebody's ill in hospital, you're doing 90% of the work, 80, 90% of the work. And with people with diabetes, they're doing 90% plus of the work. So all you are really is, hopefully, is a support and help when they need it, and how to do that, because most of the work is being done by them, not by us.
So what about, you know, I'm aware that time is ticking on, and having really interesting conversations with you both, you know, that you wear a number of hats, you know, the clinical director of many services, including diabetes at Guy's and St Thomas's Hospital. You're the clinical director for diabetes for NHS London, and also director at King's Health Partners Diabetes. And obviously you've played an important role in absorbing the information around COVID-19 and diabetes and developing guidance and policies. It's been a moving field. I'm sure there are many listeners here who would like to hear from you what your perspective of this experience has been, and where we're at now in terms of supporting people with diabetes in the COVID-19 setting.
Yeah, so I've got to be careful going to the public health of this, because I won't understand it as well, and everybody's got a daily briefing that they can watch every day about the public health bits. But nevertheless, as a hospital perspective, we have less people coming in now with COVID-19 than we were doing, and that's very good. We are all a little concerned as lockdown eases that we may see a bit more. But I think the health advice about, you know, hand washing and distancing is it does keep, and everybody else has been going to the hospital every day, and those are the safety measures we take. So we clearly believe in them. So the distancing and the hand washing. But there is less people coming in with it now. It has been in the news, so I will address it on. That there is an increased risk to people with all types of diabetes of getting iller with COVID. But the one thing I would say is the majority of people with diabetes I've seen and looked after who've had COVID have completely recovered, just like everybody else. So there is an increased risk in getting it. Clearly, nobody wants to catch it. Clearly, we should try and prevent everybody from catching it. But particularly healthy people with diabetes, you know, we do look after a lot who then go home. I just want to make sure that people do know that. So people shouldn't be afraid of going to hospital. They should seek help early. If they're worried about their diabetes or their COVID, they should get in touch with their GP or with the hospital. The hospitals are safe places. If you know, when you come here, we know how to keep people safe. We know how to keep them from catching COVID if they had any other problem. So I would strongly encourage people, if they need help, to get it, because we can deliver it safely and the vast majority stay safe and go home.
Great. I think actually it's quite possible that other people listening to us will have further questions for you. So I won't ask you any further on this, because this is for people who've got diabetes to ask their questions. So I'd now like to, so thank you very much, Stephen. We'll stop there. And we're going to just ask, is it Emma who's going to be reading out some of the chat questions?
Yes, hi. So you're right. Your last question was something that people in the chat asked about shielding, and there is a further question. So do you think that we shall expect information on stratification regarding shielding once the CMO has reviewed the evidence, Stephen?
They are discussing whether to extend the shielding. So there are, I might just get the definitions of that right. So all of us should socially distance, and all of us should be careful. And I can't remember the government phrase, stay alert. So all of us should do that. That's for every single person. Then there's a more vulnerable group, and that includes some people with diabetes. This isn't shielded, but this is a group that may want to take some extra precautions. And then there's the shielded group who really should be avoiding all contact. So this is the group who, if they come up to the hospital, we arrange special transport. We make sure they don't ever meet anybody else, even from a distance. So that's the shielded group. Now, the majority of people aren't in the shielded group, and there are very few people with diabetes in the shielded group. The vast majority of people with diabetes aren't in the shielded group. They may be in the more at-risk group, and that may mean that they have specific conversations with their employer about working from home, or if they do go into work, about how they do that more safely. But they're not in the shielded group, the majority. In all the patients I look after, there's a tiny handful that are in the shielded list. And that's not because of their diabetes, it's because of other diseases they have with their diabetes. So the government are reviewing this to see if some more people with diabetes should be in the shielded group. My personal feeling is the vast majority of people with diabetes it should not necessarily even want to be in the shielded group. The other measures should be able to keep them perfectly safe. But they may want some further conversations with their employers if it is about going into work. And again, we can support them with any queries or questions they have on that. But there will be some more advice on shielding, I think. But my guess is the vast majority of people with diabetes still won't be in the shielded group. But actually, I think they can be quite reassured just being in the at-risk group and with the extra discussions that might entail. I'm happy to expand on that if that wasn't clear.
Okay, so thank you. Sorry, Emma.
Sorry, I just wanted to ask, will people be informed about the group they belong to from their healthcare professional?
So the shielded group are informed. It was a little bit sporadic. So some people got informed by 3 or 4 different people and other people just by one. But the shielded group will be informed either by their GP, either government directly, or by their hospital, or occasionally even by the social services. So there were 4 different groups identifying people to be shielded. Some people appeared on all 4 groups and kind of got 4 letters or phone calls. But the shielded group will be actively notified. Again, I don't anticipate the majority of people with diabetes will be in the shielded group. So don't be surprised if you don't receive a letter. If you believe you should, you believe there's something very different about your diabetes, and usually it'll be about another disease alongside it. So diabetes with very advanced kidney disease is in the shielded group, for example, but only with very advanced kidney disease. So if you believe you're in one of those categories and you haven't received a letter, please contact somebody. But the truth is that everybody's been very proactive about identifying these individuals. So almost certainly you will be identified and you will receive a letter if you are in that group.
Okay.
Thank you, Stephen. We have another question for Cerith, and then maybe we can go on to the poll. So the way that you talked, Cerith, showed that you have a lot of self-compassion, which comes in contrast with most people who actually feel that they're blaming themselves for not being able to manage their diabetes. So our question from the audience was, how do you manage to develop this self-compassion?
It's been a slow one. It's not, like I was saying to Khalida before, it's not something that, I mean, it took me to the age of 27 to realize, you know what, I need to start, in essence, taking better control of my whole outlook of type 1 diabetes. Yes, I'm looking after my sugars. Yes, I'm plodding along, ticking the boxes, dotting the I's, crossing the T's, but I'm actually not embracing my overall viewpoint of it. There's no right or wrong answer. It's, you've just got to, you've got to dig deep. You've got to dig deep and just, you know, it's down to you and you alone. And I think that was quite a sort of sobering experience for me, that it's up to me, you know, every time I had a hypo, you know, and I didn't have a Lucozade bottle or jelly babies on me, it was up to me to sort it out, you know. So it's having that thought process, that mindset, but also just knowing you're not alone. You're not alone in this. So if you are struggling, people like me, people in the community, reach out to, talk. I did a diabetic course at my local hospital years ago, and it was fantastic. It normalized it completely for me. I was in a room full of other diabetics, type 1 diabetics, and we were just sharing our experiences, understanding that, oh, you go through that as well. Oh, me too. Not feeling ostracized, not feeling alone. So there's lots of different things in those ways that you can help yourself further your, you know, being more comfortable with it. So just reach out, just know that you're not alone. We're here, and to talk about it, you know.
I just want to add, I think the way I took what you said, Cerith, is that two really key phrases. One is, it's up to me, but I'm not alone. You know, and I found that combination really powerful.
Yeah, it is. I mean, it's quite, they're quite juxtaposing, contrasting, aren't they? But yeah, they're both so powerful in their own rights, because you're the one living with it. You're the one that are going to have it for the rest of, you know, live through your days. And it's only you that can, you know, if you want to take control, and everything else will follow suit. I promise you, you know, but just also knowing that we're all going through exactly the same thing. So other type 1 diabetics. So it's important to talk. If there's anything that I leave the viewers with today is just to talk about it, to reach out, you know, there's a silly question. So, because I go through exactly the same things. I go through exactly the same thought process. Oh, should I be giving this amount of units for this time? Should I split my insulin after this type of meal? Or, you know, so just, it's important to talk.
Right. Thank you, Emma.
Shall I share the results of the poll, and then you can discuss it in the 2 minutes we have left?
Thank you. So is Rebecca?
Hi there. So everyone should be able to see the poll results now. Thanks for taking part. So the first question, is your experience of diabetes represented realistically in movies and TV series? It was a resounding no for that question. And we had a few comments, I think, earlier to why that was. Question 2, a lot of people feel stressed and angry when they see diabetes reported in the media, which is quite interesting. But a lot of neutral responses as well, so quite a range there. And also a lot of people feel that diabetes isn't really represented in media very well. So yeah, what do you think about that, Khalida? Is that surprising to you?
I think that means that there's more work for all of us to do, and perhaps, Cerith, you and other actors with diabetes, perhaps there's some interesting projects around how diabetes is portrayed in the movies. That's sort of something that's food for thought for a future topic or future activities. So, Rebecca, did you want to conclude with our toolkit this week, or?
Sure. Yeah, I'll just share my screen so we can take you through some resources for this week. Good. Can you view my screen okay now?
We cannot see it yet.
Okay.
Yes, now it's ready.
Great, thank you. So the first one this week, this website, All Party Parliamentary Group for Diabetes. So they have some great kind of little blog posts, and a lot actually related to kind of mental health and diabetes. So it's worth having a look through, and they're kind of short and sweet blog posts as well. So diabetes and diabulimia, mental health and well-being. So lots of kind of interesting things there. I'll post these links on our social media afterwards as well, just so you can have a look. The second one is Jdrf. They actually really update their website quite regularly. So any information about COVID and diabetes you can find on here. So basically things like symptoms. They've got a helpline, what to do, staying at home, and shielding advice. But Stephen explained it in great detail there, which is great. Symptoms, prescriptions, so lots of information on here, and also lots of additional information. So if you're stuck or not quite sure about something, this is quite a good resource to go to. And the final one is Beyond Type 1. Now this is a US based website, but there's still quite a few interesting resources on here, and it's probably more geared to young people with Type 1. But there's quite a few interesting stories. So in line with kind of today's theme, celebrities with Type 1. So they have different blog posts, sports stars, actors, musicians, all sorts. So that's actually quite a good read. So yeah, those are our 3 resources for this week.
Great, that's really fantastic. And thank you, Rebecca, for showing them to us. Our time is up, and I want to Sorry, Stephen, yes?
I might say one quick thing in response to the CMO question earlier. As I already covered the shielding bit, it is possible that some people will be contacted by their GPs or other people if there's any specific other measures that are recommended for them. This won't, I don't think, necessarily be about shielding, but some of the information that's coming out may help us to advise some individuals slightly differently. So that is possible. I don't think it'll be large numbers more shielded, but there may be some more specific advice some individuals get. So that is something that may change.
Okay, great. So thank you very much, Stephen, for that final comment. So once again, I just want to thank you, Cerith Flinn, and you, Stephen Thomas, for joining us today. Really do appreciate your time, and actually also very much the conversation that we've had that I think all of us can take back and reflect on. So say goodbye, and we look forward to meeting you again next Thursday at 12 noon. Bye.
Bye.
Bye-bye.
See ya.
Thank you.